okay, so if I was measuring bone density, so I could look at some physical properties like strength or brittleness or um, subject to, does it fracture or not? So can you talk about, so what are kind of the properties that we would want to measure?
The properties that we would want to measure are not always the properties that we can measure very easily in living people. So what we would like to measure are mechanical properties of bone. These are the properties that really determine whether the bone is going to break or not going to break. At least it's one thing that determines whether bones are going to break or not break. And there are lots of ways to measure that. So without getting too much in depth, we can measure strength of bone. We can measure how stiff it is. In other words, how easily it can bend. And we can measure the amount of energy that's required to fracture the bone. And we can do that for the whole bone, or we can take out pieces of bone and machine them to specific shapes and measure those properties of the tissue itself. So those are two different levels of measurements that are important to bone health. As I said, we can measure strength, stiffness, and energy to fracture of a whole bone. We can also measure similar properties of the tissue itself, which gives us a little bit different information. And these can be measured in different modes. So most of our bones are loaded and bending, as you can imagine when you're walking down the street, even though it's very small and you don't realize that the bones in your lower legs are bending a little bit. And so that's a very physiological way to measure these properties. Some of our bones are really loaded primarily in compression. In other words, I think everybody knows what it means to compress something. It's the same in bone. So the vertebrae in your back are mostly loaded in compression. So we can test bones in compression, or we can test bones in tension. We can stretch them instead of compressing them. So those all give us different measurements of bone health. Those are typically are called quasi-static tests because you put a load on the bone, either in bending or compression or tension, and you increase the load until the bone breaks. And so it's not a repetitive sort of measurement. We can also measure bone properties, and it's more difficult, but it's actually more relevant in something called fatigue, where you place a cyclic load on a bone. So you repetitively load the bone at levels of load levels and strain levels that are much less than the bone would break very quickly. And you measure how many load cycles and you can apply the bone, and how long the bone will survive, how many of those cycles you can apply before the bone breaks. And you can monitor the progression towards bone breaking by looking at changes in bone stiffness. So as you load them repetitively, their stiffness will change slightly until they eventually break. So that's a more difficult but a very important way to actually measure the health of bone also.
Right. Interesting. So when I went to the lab, just a standard checkup, right, I get a T-bone score. I get a T-score, right, the bone mineral densitometry score. So and that's the only bone measure that's on any of my things. So how does that reflect anything that you kind of talked about, or is that the best measure?
Well, it's the best measurement that we have probably for measuring these things in living people.
Right.
So what that is the density of bone measures how much bone you have, basically. And if what it doesn't do is it doesn't distinguish between normal bone and undermineralized bone, because if you don't have enough bone, but the bone is healthy and normal, what you have, you could get the same T-score, the same measurement, as if you have lots of bone but it's not very well mineralized, as you can
Mhm.
imagine, because what bone densitometry measures basically is the amount of mineral in grams per squared centimeters, or now with DEXA, grams per cubic centimeters. So what it's really telling you is how much bone you have, but it can't really distinguish whether that bone is very well mineralized or not. And it gives you a measure that is a comparative measure, and it's related to the normal amount of bone that a young premenopausal woman would have, or a young man in his 30s might have. And the T-score that you get tells you basically how far away from that normal amount of bone that you should have when you're in your 30s that you may have when you're in your 60s or 70s. And the T-score itself is a standard deviation. So if you have, for instance, one standard deviation less than normal, you get a T-score of 1. That's if you have a T-score, or you get a T-score of -1. If you have a T-score of -1, that means that the World Health Organization has defined that as being osteopenic. So you're not osteoporotic, but you do have lower bone density, lower bone mass than than a younger person, and that puts you at somewhat greater risk of fracture. If your T-score is 2.5, -2.5, then that's the World Health Organization definition for osteoporosis. And as you increase that T-score, decrease the T-score as it becomes more negative to -3, -4, your risk of fracture becomes much greater. Now, bone density, at least in normal ranges, probably only accounts for about 60% of the strength of the bone. And the rest of the strength of the bone is accounted for by these other quality measures that we talked about: architecture, the way the bone is distributed, whether there's an accumulation of damage, whether the collagen and the mineral are normal. So those will account for 35 or 40% of bone strength.
Interesting. Okay, I'm just thinking. So if I have like a bad or a low T-score, right? What would be the next step? Is there another test that I can do to see in more detail?
Well, there are some that give you some additional detail. One thing the other thing that can measure bone health somewhat indirectly are biochemical markers of bone resorption and bone formation. So your bone is always undergoing periods of resorbing in different locations, and then new bone is formed in those areas that have resorbed. And those can be measured indirectly by looking at certain biochemical components, either in your blood, in your serum, blood serum, or in your urine. So you have some idea about whether you have high rates of resorption, which maybe you shouldn't have, or low rates of bone formation, which you shouldn't have, or whether you have both, which could contribute to the loss of bone. You have an imbalance between resorption and formation. So normally when we're young, the resorption and formation are pretty well balanced, not completely, but pretty well. And as you get older, these two sides of the equation begin to be imbalanced in various ways. So you can have a lot of resorption, but normal formation, or you can have normal resorption and not very much formation. Both of those will cause bone loss. And you can have any combination of those sorts of things. And so these things can be monitored biochemically by these bone markers in serum and urine.
Right. Thank you all for watching. I hope that you found the video informative. Please do hit the thumbs up button, subscribe to our channel, and hit the bell button for new video release notifications. It encourages us to continue to create more videos about anti-aging and extending healthy lifespan. Thank you so much for your kind support. I wish you all well and we'll speak to you again soon.